Started developing some shortness of breath with exertion, mostly walking in my car, doing big things like mowing the grass. At one point, I started to develop some fullness in the right side of my chest, to the right of my breastbone. It wasn't a pain, it wasn't a pressure, it was just, felt full, like I had eaten too much. I had one episode where, with walking to my car, it went up my neck. And that was when I knew I really needed to slow down till I figured out what this was, to make sure it wasn't my heart. I, being a woman, unfortunately, just thought it was because I had gained weight over the last year or two, that was mostly the concern. So I went and saw my family care provider. We did an EKG and my heart rate was up, so we adjusted my blood pressure medicine. Symptoms didn't improve, so we did go ahead and do a stress test, and that was positive. The stress test revealed that I had a large area in the front of my heart that wasn't getting enough oxygen. The major cause for that is blockages of greater than 70%. That's what shows up on your stress test. I saw the doctor that day because it was such a large area, and we scheduled the cath for the next day. It was the main artery on the front of my heart that feeds the part of the heart that pumps the blood to the whole body. So it was a very important artery. I was on the brink of having a major heart attack and having minimal symptoms. During that time, then I had to get a stent placed in my main artery. I've been doing better. I've not had any more of this fullness, chest pain, or whatever they want to call it. It has went away. So women with any kind of issues, I feel like you need to make yourself important and make it known that something's not right and you need to figure out what it is. I think it's more of an impedance if you let things go, because unfortunately those problems snowball. So at the time it may feel like you're wasting someone's time, energy, money, unfortunately, during this time, but ultimately the goal is to keep you here with a good quality of life so you can go on doing what you need to do, taking care of everyone. No one feels, as a provider, I don't feel that any of my patients waste my time. They always have a complaint or something that I can help with. That's what we're here for, and we're here to help answer questions. So working with them in that aspect, I think, is helpful.